Hello, I'm Richard Ager. Welcome to week 3 of Capital Outlook. This week, we're going to put a focus on the biggest part of the state budget, healthcare. Now, when President Obama won a second term, that meant that the Federal Affordable Health Care Act, also known as Obamacare, would continue to take effect. And that meant that lawmakers in Wyoming have to deal with it. And so they are, in different ways. And here to talk about it, we have Representative Elaine Harvey, Chair of the House Labor, Health and Social Services Committee, Tom Forslund, Director of the Wyoming Department of Health, and Ron Feemster, the health reporter for Wyofile. Welcome all of you. Thanks for joining us.
Thanks for the opportunity, Richard.
Well, I'd like to start with a major development this week in the question of expanding Medicaid to the low-income population in Wyoming. On Wednesday, a Senate Health Committee voted 4-1 against a measure that would have accepted the federal government offer to pay 100% of those costs and eventually 90%. Ron, you were there. Briefly, what happened?
Well, the first thing that happened at the committee meeting was that just about everybody who is anybody in the healthcare community showed up to speak in favor of the bill. There were representatives of charitable groups, there were people representing the hospitals, people representing physicians, nurses, the tribal health clinic, the Northern Arapaho Health Service was there, and among all the speakers, no one spoke up against the act. There was only testimony in favor of it. And then the committee voted, and it voted twice. Once it voted 4-1 against passing the legislation to the Senate floor with a due pass recommendation, which would have, I suppose, expedited it in the political process. And then it voted again 4-1 to pass it to the floor, but with a do not pass recommendation. And Committee Chairman Charlie Scott said that in his 30-some years in the legislature, he has actually seen legislation pass with a do not pass recommendation. And he did want it to go to the floor, but he is among those conservative legislators who don't like the act and literally don't want to see it pass, at least in its current form.
Well, Tom, of course, you've been at probably the vast majority of all of these hearings. Did you make any recommendations to the committee?
Well, as a director for the Department of Health, we're not there to advocate for or against a bill, simply to be there to provide as a resource. So I was there and I answered questions that the committee had, but that's all the role I played.
Okay, well, I know we'll get to the content of many of your recommendations in just a bit. Representative Harvey, do you agree with your counterparts in the Senate Health Committee that the bill should not pass?
Yes, I do. I think that I don't trust the federal government to keep their promises. I don't believe that they are going to be able, as they're struggling with their financial picture, as are we. I don't see them being able to keep up the 100% for 3 years, 90%, or dropping down over a 10-year period of time, and then lighting on 90% of the expansion group. I foresee that as they seek to balance their budget, that they're going to rely more on states for that federal match. And so I hate to sign on to that kind of a situation. However, that being said, I think that there are ways that we can look at Medicaid expansion in different ways. Can we buy health insurance for them instead and put them on the exchange? I want to see a little bit of experience of being under a federal exchange to see what does that mean and what is the expense going to be? Is it going to be cheaper for us to buy health insurance for them and then have them operate under health insurance rules the way the rest of us do?
And of course, that's another measure that we'll get to in just
Correct.
a moment, an important bill also coming up. Ron, you were mentioning that there was a fairly large turnout for that, and in fact, considerable support for this bill, which included the Medical Society of Wyoming, the Wyoming Business Coalition on Health, and of course, the Wyoming Hospital Association. Here's their reaction to that vote.
I am a little surprised because I think for the most part our citizen legislature really takes into account the opinions that are offered by by the citizens and also by organized groups that are representing different interests. So I'm a little surprised by that. I know it's a political decision, and there are a lot of conservative members of our legislature that really don't like the Affordable Care Act and just have a problem with some of the implementation of that.
Representative Harvey, there was one more point you were saying you were going to touch on.
Yes, you know, if we come back next session with a plan of how to operate the Medicaid expansion in a different way than it's offered to us now, we only lose 3 months, because the federal government has assured us that if we choose Medicaid expansion, we don't have to wait for a fiscal year, we don't have to wait for a deadline. If we pass it, then it will be in effect. So if we can come to some points of comfort to where we feel like the state of Wyoming will not be picking up the entire bill for this, I'm not against expansion. I'm against obligating future legislatures to bills they can't pay.
I also think that the stage is being set for passing this bill next year. And I think there are some other political considerations as well. I think there's one of the things that's happening now is that people are getting a chance to kind of campaign around the bill and get their anti-Obamacare credentials sharpened up a little bit. I think there's certainly a part of that. But I would also point out that the flexibility in the Medicaid law, as I understand it, is going to take effect as the implementation begins. And it would certainly be possible to make changes in the law and in the way Wyoming implements the law after expansion. In other words, it would be possible to push off from the dock and rebuild the ship slightly while it's sailing. You wouldn't have to do the whole thing in dry dock and launch it in April of 2014.
You know, Ron, if it were in dry dock, then I think I would agree with you. But I have to tell you that I've been following this for 3 years, and it is a moving ship, and we don't know what port it is in. We don't know what sea it's sailing on. Rules are being promulgated. They've been very, very delayed. We don't know what the picture is full time, and we're just not willing to sign a blank check. We're just not. And the rule promulgation, and then meeting with the feds. I meet with them 4 times a year, and the answers that they give us are pointless. We ask a direct question about rural and frontier health, and they say that's a good question, and we'll get back to you on that. It's the most common answer we heard. And the second most common answer we heard is there are rural areas in New York, there are rural areas in California, you can serve that, but we still don't have the economy of scale.
To the point, though, of the Medicaid expansion, Tom, you were actually asked by the governor to do the study of what it would cost and what the various benefits versus costs would be of extending coverage to poor single adults who are not currently eligible. Your conclusion, it would save the state $47 million. How would it do that?
The concept that we looked at is called offsets, and that is that currently the state provides a lot of services kind of as safety nets, and they're funded 100% with state general funds. And with the implementation of the Affordable Care Act, which starts next year, that everyone will have insurance is the theory, and it'll take a little bit of time, but they'll ultimately have insurance. So what they'll be able to do is the providers can bill their insurance companies for those costs instead of the state paying for it 100%. So with that in place, we would be able to reuse or repurpose those funds, just state general funds, and pay for the expansion of the Medicaid program. If we did the full expansion, our analysis showed that we could generate approximately $47 million in savings over a 7-year period of time. If we don't do the full expansion, then we won't have the ability to do all these offsets, and it'll cost us approximately $79 million over the same 7-year period of time.
And then it's because the federal government will be picking up more of the costs that are currently borne by the state through our own general fund.
Yes, current.
Well, you know, one thing that struck me about some of the support for this bill was that in that one of the backers of it was actually the Wyoming Business Coalition on Health, and that's got members like Peabody Energy, Arch Coal, First Interstate Bank. And they complain that right now they're indirectly paying a hidden tax. This is what they said, which are the costs of the uninsured, which places them as businesses at a competitive disadvantage. I'm wondering, that didn't seem to have much effect on the committee.
I think you can see a little bit of reaction to that. One of the arguments that's been taken most seriously in the discussions that I've had with legislators is the issue of uncompensated care, overuse of emergency rooms. These are costs that are borne directly or indirectly by everyone. And I think that you know, the business community is certainly as loud as anyone about it, but they're maybe better at making their voice heard. The thing that I heard at the committee meeting was, you know, a direct counter to this argument that we shouldn't trust the federal government, which I think is the core argument of the opponents. People have said, you know, I have a primary health clinic. There are, you know, thousands of them around the country. We've been getting grants from the federal government to run these free clinics. That's essentially, you know, the federal government paying for medical care anyway, and this money has been coming in since, you know, the end of World War II. No one has ever missed a payment. The Medicaid match is currently 50%, and you know, that check arrives every year as far as I know. I think Director Forslund would know that better than I. But
Well, I found it interesting is that, as you said, that they were saying we don't trust the federal government, but ultimately what that means is because we don't trust the federal government, we're prepared to pay on average $12 million more a year to support the Medicaid program. And so essentially it doesn't start this year, but after starting next year, the state's going to have to ante up an extra $12 million per year to because we're saying we don't trust the federal government.
Well, Representative Harvey, the governor so far has been non-committal on this. He did, of course, ask for the study, but he hasn't come down firmly on one side or the other. He's just saying he's not supporting it right now. Right. Do you think he's kind of looking for a signal from the legislature, some kind of backing to enable him to make a decision if he were to go for it? Because other Republican governors have been going for it, as Ron wrote about this week.
Well, first of all, we tied the hands of the governor in our last legislative session and said that no individual or organization, meaning the Department of Health, the Department of Insurance, or the governor, could commit Wyoming to an exchange. And so, and I think that the governor took that as a signal with the Medicaid expansion as well. And Richard, I have to tell you, I don't have a crystal ball, and I can't tell you what the governor thinks. But I can tell you that I do consult with him, and that so far I haven't heard anything other than we want the best possible for our citizens. So I just think, and I think it's worth $12 million the first year. I think it's going to cost us far less than $12 million the first year. I think we can pay that. It's the commitment to the future legislatures that I worry about. I really do think that the federal government is not going to be able to maintain 90% over time.
You know, when you say that, I guess what occurs to me is if we don't think that we can rely on them for that money, then what about all of the other sources of federal funds that we rely on them for, such as roads, transportation? I mean,
let's talk about some AML money then.
Well, that's a somewhat separate issue.
Well, but it's the same thing.
That was the Congress that
Congress can still work with that. Congress still has the power to change that. Congress has to balance their budget eventually, or at least they have to get. I mean, if business thinks they're paying for it now, hang on to your hat, boys, because your taxes are going up, and they're going up in every way, and they're going up tremendously.
Well, Yeah, I'm not sure that I buy the AML argument. I think that was tacked onto another bill, and this is going to have to be done under much brighter sunlight than the AML thing was. I'm not, and and on the other hand, I have written before about the difficulties that the governor had and that you've had dealing with HHS. I completely acknowledge that this is not an easy process, and that it's very, very hard to get information out of the federal government. I'm sure I speak for more reporters than one when I say that I've actually had that problem as well. It's not easy to find out what's going on in Washington. On the other hand, I think that it seems to me to be a very radical statement to say that we don't trust the federal government about health care. The other things that we have not trusted the federal government about are very few. You really have to stretch to find instances when Wyoming has turned down federal money. And many other states that were initially skeptical about this, and governors that joined the lawsuit against the Affordable Care Act, have turned around, including western states that are not that different from Wyoming. So I think that ultimately the fiscal argument is going to win out. Ultimately, I think that people will get tired of the $12 million a year. You'll say it's worth it for 1 year, but I don't think it's worth it in perpetuity.
And Tom, you would be the one in the end that would have to make the final decisions on what to do with whatever the funding is that's available. So I have to wonder, are you looking at those savings? I mean, have you been counting on those savings that you found could exist to then help in other areas of the Department of Health's activities?
Well, what we presented to the Joint Appropriations Committee and also shared it with the Joint Labor Committee was a alternate budget proposal, and that was in response to the legislature saying, Department of Health, we want you to cut $19 million in 14 and another $76 million in 15-16. And we said, we have another proposal for you to consider, and that is if you allow us to expand the Medicaid program and to the full population and give us some other flexibility to truly manage our operations, then we would commit to keeping our budget flat for a minimum of 4 years. And so that proposal is out there, and hopefully that will be considered at some point.
Well, I'm sure you'd sure like to have that $12 million per year. We've only got 5 minutes left, and there was a couple of other bills that I wanted to get to. One is, of course, Senate File 60. Now, that's the one that it gives direction to the Department of Health on reforms, and it removes the caps on the number of people who can participate in so-called waiver programs, which Tom, I'll get you to explain those briefly, but you've told legislators, this is a quote that stuck with me, we have what some call a Cadillac system for those on waivers, and then we have nothing. And I guess that gets into some bureaucratic weeds here, but in other words, some people are getting like the full service treatment, that Cadillac treatment, and others, because we don't have the funding to extend it to everybody, get nothing. You want to replace that with a different tier system, don't you?
Yes, through the course of this last year, the Department of Health, in conjunction and working with the Joint Labor Committee, looked at trying to make changes to the Medicaid existing program. And one of the areas that we looked at in terms of one of the major cost drivers of the Medicaid program is the waivers. And that is assistance for those people with developmentally disabled, who are developmentally disabled, both adults and children. And that's the highest cost portion of the Medicaid program.
Because some are on a waiting list too.
And as a result, what happens is we have some people who have a full array of benefits, and then we have a very large waiting list that gets larger all the time. And the legislature is always in a position to being lobbied to take people off the waiting list, and just gets to be a more and more expensive. And so what we're saying is, if we have something called a support waiver, which is much less costly, we can serve more people with the same amount of money.
But can still be a big help because it might keep people in their own.
I think you're forgetting a leg of the stool, and we have a bill that is over on the House side, and it is a study bill for the training school in Lander. So when we talk about a Cadillac plan, I think you need to refer to the Life Resource Center in Lander. $330,000 per person per year. On the Medicaid waivers, the average is $66,000 per year.
Of course, these are the people who need the most assistance.
There are people who would have just as significant of disabilities in community programs. So the question is, why are we having 430 people care for 90 people in an institution with aging buildings, with far too much acreage to maintain? Why are we having the Cadillac and the Ford and the nothing? I think that we need to rebalance the whole system of developmental disabilities and bring that facility in Lander down to the size of staff and the size of facility to an intermediate care facility.
Is that the intent of the study?
That is, the intent of the study is to look at, can this happen? The intent of the study is not to close it, but can we do things differently that will make it work better, and then free up some of that money for those who have nothing. Because I think just taking the money that's already in the system with the waivers and rebalancing it, that there may be some further disparities and there may be some businesses at risk.
We have less than a minute left, and there was one other thing I wanted to get to, which is, of course, a bill that you have sponsored, which is to set up a study committee to get into the health insurance exchanges. So in like about 20 seconds, what's the task in front of you?
We're going to be watching the federal government. They have to start submitting plans in April to the Department of Insurance. Insurance companies have to be approved with state approval to be sold in Wyoming. And then in October, we expect an open enrollment period. We'll know what plans are being offered. We know what the cost of the plans will be. We'll know who is going to buy them. And then the second year of the study.
That's the last word. So we'll get to the second year later, okay? Because that is all the time we have. Our thanks to Representative Elaine Harvey, Tom Forslund, and Ron Feemster. And as is our custom, the last word goes to the citizens, the coffee drinking citizens of Wyoming. We go back to Wheatland for more of our conversation at the Western Skies Family Diner. This time our citizens spoke about the health bills before the legislature. In particular, they talked about Obamacare and the effects it's already had, including no pre-existing conditions for children and insurance for young people under 26 under their parents' coverage.
I'm not in favor of providing health insurance for my child till he's 26 years old. I think he needs to learn to be self-sufficient at some point. I've spent the last 18 years trying to teach him how to be self-sufficient, and now somebody's telling me that he can stay on my insurance plan till he's 26 years old. I'm not sure that that's the best option. I'm not sure we're teaching our kids the right things by doing that.
I believe that was originally intended to cover young people who are students in going through college, so they don't have full-time jobs to pay for that.
Well, but even I was taught that if you wanted something, you worked for it. I got a job when I was 20 years old that provided insurance, and I finished my college degree after that. I'm all for the fact that, going through the first 4 years after college, but extended degrees and things like that, I'm not sure that, that's not my employer's responsibility to pay for my child's insurance to that point.
Do you think that health care is a right, or is it something that must be earned?
I don't have an opinion on that, and that is absolutely the truth. I see advantages to both ways. I would hope that some health benefits would be there for everybody, and
but philosophically,
they are.
Philosophically, though,
someone's got to take care of our populace, and I think right now the government picks that up. The federal government pays for something, but is there a better way? If there is, then let's work toward that. If we're going to trade one program that doesn't work for everybody for another program that doesn't work for everybody, then we need to drop back, take a look at it, and reevaluate and do something different. And I think that's where we are.
I think it's really hard to say. Obviously, if you have someone who doesn't have any insurance and they go into a hospital with a gunshot wound, I'm not going to sit there and say, well, they don't have insurance, so sorry. You know, I don't think that Americans they don't think that way. I would hope not. But I also think, you know, I agree with Randy that I think people should strive to be independent and work for that insurance. That's something that I've done also, and since I was, you know, out of college, and I don't think that we should necessarily just be giving out handouts either on that. So.
Yeah, I agree. I think it should be earned.
All right. The second aspect of the healthcare situation, which is of course the potential expansion of Medicaid, which the federal government has stated would come at pretty much no cost.
If it truly does save the state money, I would be in favor of it. But I would want to see. I've seen a lot of tests where they say they have proof, and they've done a lot of tests that have failed. I mean, if it was something that truly worked, I'd be in favor of it. But I would be skeptical. Today, I'm skeptical of that ability to make it cheaper.
You seem to be conferring with some notes here. What do you think?
I remember I was
Don't read them off, just tell me what you think.
Typical newspaper reporter.
I was reading earlier in an article that Governor Meade had recommended that Wyoming rejects this. So, and I was going through my notes trying to find out again why he had proposed that. And I just found that he basically said he doesn't trust the federal promises that they'll pick up the bulk of the tab. So I'm not sure why, you know, but that's what he's saying.
Yeah, a cup,